Hi, this is Dr. Amar, Chief Consultant, Laparoendoscopic, Robotic, Bariatric and Metabolic Surgeon from Dr. Amar Bariatric and Metabolic Center, Jubilee Hills, Hyderabad. Does intragastric balloon insertion has any role in weight loss treatment? Intragastric balloon insertion is an endoscopic non-surgical method to treat obesity. Bariatric surgeries are indicated when body mass index is 32.5 and above, while lifestyle modifications are enough when body mass index is less than 27.5 kg per meter square. When the body mass index is between 27.5 to 32.5, intragastric balloon insertion can be considered as an alternative method when people are not able to lose weight by lifestyle modifications. It can be considered even in those people who are eligible for bariatric surgery, that means when the body mass index is 32.5 and above, but they are afraid to undergo surgery. It is indicated when the weight burden is not more than 5 to 10 kilograms. How will you do this procedure? After checking for the eligibility and making sure that patient is fit for this procedure, we do upper gastrointestinal endoscopy under short general anesthesia or sedation. First, we will make sure that there are no contraindications for this procedure, such as large hiatal hernia, reflux esophagitis, gastritis and gastric ulcers. Once we make sure that we can insert the balloon along with the tube and guide wire are inserted. Once the balloon crosses the gastroesophageal junction, guide wire is removed and balloon is filled with normal saline mixed with methylene blue until balloon volume becomes 500 to 700 ml, and this filling is done under vision. The actual volume of balloon can be adjusted depending upon what we see while filling the balloon. Either we can reduce the volume or increase the volume depending upon the stomach size. Once balloon is filled up to the desired volume, tube will be removed and a valve will seal the balloon and tubing junction, and endoscope will be removed. Patient will be kept for observation for 12 hours and can be discharged. Arbera balloon is an intragastric balloon approved by FDA. This can be left in place for 6 months. There is Arbera 365 balloon which can be kept in place for 1 year. There are adjustable balloons. Example is Spatch adjustable balloon, which will have an elastic tubing that can be used to fill the balloon. The advantages of adjustable balloons are we can adjust the volume of the balloon more than once. So initially we will fill the balloon for 300 to 400 ml. Once the patient gets adjusted to the presence of balloon, we can do re-endoscopy and refill the balloon up to 600 to 800 ml or the desired volume. We can readjust further depending upon whether the patient is losing more weight or less weight, or if the patient is having any intolerance. But the problem with these adjustable balloons is the tubing can go and get lodged in the duodenum and it can block the gastric outlet, which can cause colicky pain or balloon intolerance. There are swallowable balloons also, which are less effective than these Arbera balloon or Spatch balloon. We shall talk about these swallowable balloons in another video. How does balloon work? Balloon works mainly by food restriction. It cannot change the hormones which control body fat. That is why they are very less effective or very inferior procedures compared to bariatric surgeries. How much weight loss you can expect with a balloon? On average, you can lose 5 to 10% of total body weight. Approximately, this accounts to 5 to 10 kilograms of weight loss. Some people may lose even more weight. There are people who lost more than 30 kilograms with balloon insertion, but that's very rare. 1 or 2 out of 100 members can lose like that. By showing those people, we can't expect that everybody will be losing like that only. On average, you lose 5 to 10 kilograms. Some people may not lose weight at all. Some people, in spite of presence of balloon, they can gain weight. Balloon insertion has to be combined with lifestyle modifications to achieve maximum results. We can also add oral semaglutide tablet, which is a GLP-1 hormone analog, to increase the weight loss effect of balloon insertion. What are the advantages of balloon? It's a non-surgical procedure. It's a daycare procedure. 12 hours after balloon insertion, we can discharge the patient. What are the disadvantages? Generally, balloon insertion is very safe, but first 1 week to 10 days can be horrible. You can have severe abdomen pain, that's a colicky abdominal pain, severe nausea, vomiting several times because of intolerance, because your stomach didn't get adjusted to the presence of the balloon. These symptoms can be managed by using medications. These symptoms will disappear over a period of time. Some people may require intravenous fluids during the first few days if they are having severe symptoms and they are not getting controlled with medications. For some people, intolerance can be very severe. In these people, in spite of using medications, these symptoms will not come down. In such people, we may have to remove balloon within the first 1 week. Spontaneous balloon deflation or balloon leak, it's very rare. Because we fill the balloon with methylene blue mixed normal saline, if balloon starts leaking, that fluid will come out. So urine will turn into light blue color. So if balloon is inserted, you need to observe for any change of the color of urine into blue color. If you observe that, you need to contact your surgeon immediately so that if there is any balloon leak, that balloon can be removed. If the balloon leaks and you haven't noticed that, balloon completely deflates, it can go down through the intestines and most of the times it will pass out. Or sometimes it can block the intestines, leading to intestinal obstruction, for which we have to do laparoscopy, open the intestine and remove the balloon. This is a rare complication. Generally, spontaneous leak or deflation occurs if you try to keep the balloon for more than its actual duration. Arbora balloon can be kept for 6 months. Arbora 365 balloon and Sparge adjustable balloons can be kept for 1 year. Most of the effect of balloon will be for only 6 months. Even if you keep for 1 year, you are not going to achieve any extra weight loss. Stomach perforation is a very rare complication of balloon insertion. If anyone is having gastric ulcer and if you keep a balloon, that risk of perforation will be there. We keep patients on proton pump inhibitors and antacids or sucral fed syrup as long as balloon is present. This is in order to reduce gastritis or gastric ulcer risk with balloons. Balloon insertion is for temporary weight loss. Once the intragastric balloon is removed 6 months or 1 year after the procedure, 95 to 99% of the people will regain weight because of the effect of the hormones controlling body fat, and because most of the people don't stick on to lifestyle modifications. Balloon insertion is for temporary weight loss. It is not as powerful as bariatric surgery and it cannot replace bariatric surgery. If anyone doesn't need to lose more than 5 to 10 kilograms, we can consider balloon insertion. And if anyone is afraid of bariatric surgery, we can consider this. Since weight loss is not because of the hormonal changes, weight loss after balloon insertion is not that effective. If you are not interested to go for bariatric surgery, instead of balloon, we can consider endoscopic sleeve gastroplasty, which is superior procedure compared to balloon, and weight loss is even better. But even endoscopic sleeve gastroplasty also, the weight loss is not that powerful compared to bariatric surgery. If you are considering balloon insertion, if you want to check whether you are eligible for balloon insertion or not, please do not hesitate to contact me. Thank you very much.